I'm Dr. Andy Scoles with Scoles Family Chiropractic. My wife, Dr. Jennifer, and I have been in practice in Carnes since 2002, and I just wanted to make a quick video to explain a little bit about what chiropractic is, what chiropractic is not, and what you can expect to experience during your first visit at our office. Most people come into a chiropractor because they may have some sort of an ache or a pain. Some of the really common things that people see us for are going to be things like neck pain, back pain, carpal tunnel syndrome, headaches, sciatica, which is pain down the back of the leg, migraines. We even see a lot of children for things like ear infections, asthma, colic. A lot of those are pain symptoms. But the first thing I want you to realize is that very few of the nerves going through your spine are pain sensitive nerves. In fact, it's about 3%. If we were to look at a chart with all of the nerves passing through your spine, just this little inner circle of sensory nerves are the ones that feel pain. That means the rest of them are doing important things like moving your muscles, those are your motor nerves, and controlling all of your organ function. So every cell, tissue, organ in your body is controlled by nerves passing through your spine that allow them to communicate with your brain. That's why we're always looking at our patients' overall function and their overall health of their spine to make sure things are working as well as possible. A great side effect of getting the nerves functioning properly is that people start feeling better also. Those aches, those pains, those headaches, those things start to go away as we get that proper communication in there. So on that first visit, when people come into our office, we do a couple of things to determine where the nerves are being pinched. Since they don't all feel pain, you can't just necessarily tell us, oh yeah, it hurts right here, and we know exactly where we need to adjust you. We have to figure out where the problem is. So we do some things. This is a scanner that is infrared. It was developed by the Space Foundation for astronauts up on space station missions. And we use this to roll up your spine and look for any hot spots. When a nerve gets pinched, it tends to get hot, kind of like a frayed electrical wire. So that gives us some information as to the nerves going to your organs. We also use these sensors. They determine any muscle spasms in your back, so that shows us the nerves that control muscle function. So those two instruments give us an idea of about 90% of your nerve system function. From there, we're probably going to take some x-rays so that we can see if any of the bones have shifted out of alignment and are putting pressure on these nerves. And then after that first visit, we'll analyze those x-rays. And usually on your second visit, we'll have you come back in. We'll go over those x-rays with you, show you exactly what we found, come up with a care plan, a way to actually correct these problems for you. Once we start correcting them, what we normally do is use our hands to adjust those bones back into place. Some people prefer an instrument adjustment. This one's called an activator, has a spring inside there. We can use that to adjust you. This works great with little children, people with osteoporosis, people that have maybe had previous back surgeries. We can use this in those areas. It's a little more gentle. And then people who just generally don't like the sensation or sound of a regular manual adjustment, moving the bones back into alignment. So there are options for different people. The most important thing is just making sure that we get those bones back where they need to be, getting that pressure off your nerves so that your brain and body can communicate the way that God intended it to. So if you have any questions, you can call our office. We look forward to seeing you. Have a great day.